We all know someone who is dealing with diabetes, who's struggling with diabetes, maybe as ourselves or in the pre-diabetic phase. It's something that is very, very common in the Muslim community. So I'm really excited because we have two very special guests with us today who are not only going to tell us what is diabetes and how we can, deal with it and manage it in Ramadan, but they're actually going to share some really, really exciting information and research on how we can treat and even cure diabetes through things like exercise and healthy eating and weight loss, which a lot of the times we don't discuss enough, right? A lot of times we talk about just managing diabetes. Some really, really exciting research is happening that Dr. Muhammad Shrayyef and Dietitian Noura Sheikhalzoor are really engaged in. That's really, really going to be helpful for you and anybody who you know who is dealing with diabetes, inshallah. So assalamu alaikum, this is Amina from Amana Fitness, and I'm really excited because we have some very, very special guests. So Dr. Muhammad Shrayyef is with us today. He's an endocrinologist. He's the founder and medical director at the Thyroid and Hormones Endocrinology Center. And he is also a fellow of the American College of Endocrinology. And mashallah, he's been doing a lot of this really great research in terms of diabetes and actually really dealing with it from a weight loss and great perspective. We also have with us Noura Sheikhalzoor. She's a registered dietitian and she practices the Thyroid and Hormones Endocrinology Center in Oakville. So both of them are with us here today. So we're really excited to have the experts here with us today. They're just hopping onto the stream. Assalamu alaikum.
Alaikum salam. How are you?
So, belated Ramadan Mubarak. Thank you so much for joining us.
Ramadan Mubarak.
Ramadan Mubarak. Thank you.
And so I just wanted to, kind of start off and ask you, Dr. Shrayyef, so what is diabetes? Because a lot of people, they maybe have this condition or they know somebody who has it in their family, but they don't really know what exactly it is, what it means, and how it really affects their lives.
Sure. Thank you. Thank you, Amana, for inviting us today. So, I will start with diabetes basically means the elevation of the blood sugar. And there is, we should focus on two kinds of diabetes, type 1 and type 2, because they are very different. Type 1 diabetes is caused because there is not enough insulin. The second kind of diabetes is type 2, which is caused not because of lack of insulin, actually because insulin resistance, which is well associated with the weight, with increased weight. So the more weight we gain, the more high carbohydrate we take, you will end. We have higher chance of having type 2 diabetes.
Okay, so that's kind of something that a lot of people might think that if I gain a lot of weight, I'm at a greater risk for diabetes. So is that true?
Absolutely, absolutely.
Okay, so you were mentioning that you're doing, some really amazing treatment options in your clinic that really focuses on dealing with diabetes from a weight loss perspective.
For any diabetic person, we need to focus on few things. We need to focus on diet, exercise, and weight loss, as well as taking the medications if needed. So we have an amazing program. We have a Noura on board. She is a great dietitian here. We have a nurse who focus on weight. We have, for morbid obese people, we have Dr. Anas Al-Qasim, who is a bariatric surgeon. And for those who would want to go for that and they need to go for bariatric surgery, many of them, they either cure their diabetes or diabetes will improve significantly.
So I want to kind of look into that a bit deeper, because in extreme cases, you're having people go to bariatric surgery to deal with their diabetes. So if a person themselves before that stage were to lose weight, how would that affect their diabetes?
Absolutely. Any weight loss would be a significant help in helping that in curing diabetes or improving diabetes. Of course, so if you lose 5 to 10% of the weight, diabetes will improve significantly. If you lose 20% or more, your diabetes will be probably cured.
So this is really, really interesting, because a lot of people, they think that diabetes is just a chronic condition. Once you have it, you're living with it forever. But you're saying that if you lose just, as much as 20% of your body weight, your diabetes could be basically cured.
Absolutely, or at least significantly improved on, and you could stay on much less medication than what you are on now.
Yeah. So this is incredible. You could decrease your medication, basically significantly improve your diabetic experience just from prioritizing that weight loss and making it happen. And, to really, really understand what these options are. So on one hand, you have this weight loss that, for many people can seem really difficult. But on the other hand, I want to talk about what are some of those common complications that happen in patients with poorly managed diabetes. What does that worst case scenario of diabetes really look like?
Well, we know that for each 1% increase in the hemoglobin A1C, there is increase by 21% in death from diabetes. There is about 36%, 37% in complications with eye problems or kidney problems. And there is about 15% of having heart attacks. So that's if your sugar is running around 8 to 9, you have all these. And the risk increase with each 1% above that.
So you said eye and kidney problems. Like what does that look like?
In the beginning, you start having protein leakage from the kidney, so more protein in the urine, and then slowly after years you could end up with hemodialysis. You could basically the kidney will shut down and you will need hemodialysis.
So that is where you need to like basically be strapped up with a machine into your kidney, right?
Absolutely, sitting there for 3 hours, like 3-4 times a week.
Oh, so 3 or 4 times a week getting strapped to your kidney, a very, very difficult lifestyle, right?
Absolutely.
And so then you mentioned there's some eye complications as well. Like a lot of people don't think about your eyes being affected with diabetes. So what happens there?
See, the diabetes affects all the vessels in our body. So affect the vessels of the kidneys, causing kidney problem, affecting the vessels of the retina in the eyes, causing problems. So initially hardening of the vessels, and then also leakage of the vessels, causing in some cases even blindness.
Blindness.
Absolutely.
So that's incredible. I mean, the diabetes could get to a point where you experience blindness. Nobody even, really thinks about that. I think that, it's a really big mistake that many people think, oh, I have diabetes now, I'm just going to manage it. But you mentioned that there's some really poor outcomes that could happen in poorly managed diabetes. Absolutely. Blindness, all of this complications with your kidneys. And then, if you put that on one hand versus this recommendation of just basically losing 20% of your body mass, that's what would you rather have in that case, and that's something that we really need to emphasize, I think.
Absolutely.
So how does sugar play into this whole picture?
Think about it this way, Amina. The vessels in our body, it's like, when the donut is glazed with sugar, so our vessels can be like that and becomes hardened, so that sugar stick to the vessels and make it harden, and then easy to break and cause leakage and causing blindness, as example, in the eyes, or causing problems in the kidneys.
So it's like creating like a blockage inside the tubes, and so the more sugar you have, is it the more blockages that happen?
Absolutely.
So that's kind of something that really needs to be taken more seriously. I think especially in the Muslim community, a lot of people, they say, oh, my doctor tells me not to eat sugar, and my doctor tells me to lose weight. And it's almost not with the understanding that cutting down the sugar, decreases the blockages. Losing the weight can tremendously affect your experience with diabetes. So that's something that we really need to educate more on.
Absolutely. There's a lot of relationship between high sugar and inflammation markers, and even cancer.
Cancer as well.
Absolutely.
So you mentioned all of these, kind of like complications. We have 21% increase in death. You have the blindness. You have these kidney complications, increased risk of heart attack, and all of this and even cancer as well. All of that it can really be much better managed with weight loss and reducing the sugar. That's really incredible, and something that we all kind of have to reflect on. So just question, I'm curious. We know that obviously that South Asians are more likely to be overweight and to have diabetes. And we see that this is a little bit more of a problem in the Muslim community. Do you find that as well in your practice?
Absolutely. For some reason, I think genetic reasons, this population has more likely to develop diabetes. It's also culturally, they eat more rice and more carbohydrate. That's definitely a significant cause of having a higher rate of diabetes in that population.
Right. And that's really sad, that this is something that's specifically affecting many Muslim populations. And obviously there is a genetic factor, but like with anything else, there's your genetic disposition, and then there's how you manage it and how you eat according to that. And so we kind of have this killer combination of a very poor diet for many people, high in the carbs, and then on top of that genetic predisposition, not a winning combo at all.
Absolutely.
So I wanted to go a little bit deeper into, Ramadan specific issues, because, Ramadan obviously poses a very interesting need for different people, and especially for people with diabetes. You have obviously the need for medication, you have kind of your blood sugars that'll be kind of up and down throughout the day. So what are some particular considerations that patients with diabetes have to think about before, approaching Ramadan? What's different for them in Ramadan?
Well, first, of course, we need to differentiate between type 1 and type 2 because those are two different diseases.
Mm-hmm.
So for let's talk about type 2 because type 1 is more difficult to manage with fasting during Ramadan. But for type 2, there depends on the situation of the kidney function, if there is a risk of dehydration, that might affect the kidneys to get worse if that's a complication that the patient already has from diabetes. There is also the kind of medication that he is on or she is on. Are they on medication that they can lower the blood glucose significantly below normal and they can cause low sugar hypoglycemia? Mm-hmm. So between the dehydration and the hypoglycemia, those are the main problems with type 2. There's also, with type 2 diabetes, they could also have hyperglycemia, less likely though, during fasting due to prolonged periods between meals. In type 1 on top, go ahead.
Or just before we get to type 1, so you mentioned that kind of you have to kind of consider the patient's existing level of diabetes and how their particular diagnosis is. So you said that kidney function is something that you would consider for an individual patient before, considering if they're able to fast. And then previously we talked about that, your kidney function, that can really be helped with weight loss. So that's a really big motivation, right? For somebody who's approaching Ramadan, lose weight, and inshallah you'll be able to fast maybe if that's something that your doctor approves. Inshallah. But if that's, the overweight patients who are having poorly managed diabetes, they're less likely to be able to fast. Is that right?
Fair to say.
Okay. So yeah, so you mentioned kind of hyperglycemia, hypoglycemia. That has to do with your blood sugar, right? So what is that?
Hypoglycemia is low sugar. So basically, glucose below 4 is considered hypoglycemia. And the risks for that is with significant hypoglycemia, patients can even go to coma. They can go into, they lost their consciousness and they go into deep coma.
Wow. So that's really something to keep in mind because everybody knows a family member who says, oh, my doctor tells me not to fast, but I'm fasting anyway. So there are some real risks associated with, making that decision by yourself without, a medical professional's recommendation.
Of course.
Wow. So you said, and then you mentioned hypoglycemia, hyperglycemia. Obviously, we're going to get into all of those food recommendations on managing that a little bit after with Noura. But then
right.
you also mentioned that type 1 diabetes is a very different experience and kind of you have to make different considerations.
Type 1 diabetes also, they have a problem of that the prolonged fasting, they can also create acid in the body called ketoacidosis. And this is a very dangerous condition. So, even just the prolonged fasting, they can induce acids in the body and be quite challenging.
So would you say that it's more likely that a well-managed type 2 diabetic patient might be able to fast versus a type 1?
Exactly. Okay. So probably most of the type 1 diabetics, probably they cannot fast.
Okay. And so again, what do the risks look like if a type 1 diabetic patient decides to fast in
Ramadan? Most of them, they will get into their sugar will go between high and low and, dehydration. Most of them, they get into a lot of troubles.
So, that's that case where this is something you have to talk with your doctor and, ask them about what's type diabetes that you have and, kind of how can you best manage it in Ramadan. What are some questions that people can ask their doctors? Obviously, your patients are so lucky because, you're also practicing Ramadan. You know how important it is to Muslims. But for many other patients, who are maybe speaking with a doctor who doesn't really know the importance, and so then they're thinking, well, they don't even understand Ramadan anyway. What are some questions that they can ask to make sure that if they're able to fast, they could, but if they're not, they're really following that doctor's recommendations?
So understand the medication that the patient is on. So are they on medication that will potentially cause that the sugar will go very low? And if that's the case, it's recommended to decrease those medications, like insulin, to decrease the amount of insulin during fasting, of course, with approval of the doctor.
Yes.
If the medications, some of the medications would not cause hypoglycemia, they would rather prevent hyperglycemia. And those are in general very safe during pregnancy, during fasting, sorry.
Okay, so that's, a case where, you just don't take the medication. You ask the doctor kind of what is the purpose of this medication? Why am I taking it? And then, if your medication is kind of associated with hyperglycemia, maybe that's a case where you would be able to fast, versus if it's a hypoglycemia, then is that a case where you're recommending that patients don't fast?
General guidelines, of course, we take each case separate,
Yeah.
We go case by case.
Yeah. Yeah. Okay. So, but, kind of speaking to your doctor, asking for that additional details, and then, kind of learning a bit more about your medication in Ramadan, and then
Right.
making that decision
Right.
with your doctor at that point.
Sure. So one question would be kind of like, well, if I decrease the amount of insulin, do you think I can fast? I think that's a reasonable question that will drive some nice conversation, nice discussion to assess the risk of potential harm from fasting in that particular patient.
Okay, because that's something, that a lot of times when we get just general recommendations, a lot of people, they just say, listen to your doctor and follow the recommendations. But then this is a really helpful question to, suggest that Muslim patients ask their doctor that if I were to decrease my insulin, would that change my ability to fast? That's something that potentially could be very helpful for Muslim patients.
Right.
Okay. And then obviously there's that fact. So how would losing weight make that Ramadan experience maybe a little bit easier or better for someone in Ramadan?
Well, again, we need to talk about lifestyle before and during and after Ramadan. So if we have a healthy lifestyle and we maintain that healthy lifestyle, having light exercise, decrease the amount of carbohydrate of the sugar that we take, and having monitor what we eat, increase the vegetables, decrease the carbohydrates. That's all help into getting through healthy and less problem with hypoglycemia or hyperglycemia during Ramadan.
Okay, so yeah, and just in a bit, we'll ask Noura for more of those recommendations on maybe catering the diet that you're having in Ramadan around your diabetes. But this is a case, again, that we know, everybody knows that diabetes patients who might be fasting, they're really just kind of going through Ramadan just like everybody else. And, there's some specific things that they have to consider, that if you want to be fasting, that's a responsibility that you have, right? You have to learn that, can you fast or not? That's a responsibility. And then if you are taking on that responsibility, despite your diagnosis, you have to know that, it's a really, it's a big responsibility that you have to be eating and treating yourself in a way during Ramadan to be managing that properly.
Absolutely.
And then I also wanted to ask you, so then,
right.
And,
we should also remember that Allah subhanahu wa ta'ala asked us, like, we shouldn't put ourselves in harmful situation. لا يكلف الله نفسا إلا وسعها.
Yes.
So for those people who cannot fast, Allah subhanahu wa ta'ala gave them the option that they should exercise the fidya. And as Allah subhanahu wa ta'ala, as Allah subhanahu wa ta'ala, it's part of ibadah to fast. It's also part of ibadah for those who cannot fast is to practice the fidya.
So yeah, that's something that a lot of, I can definitely sympathize, that feeling, that frustration that I can't fast. but realizing that number one, that, you know, that for this type of sickness, there is that accommodation being made for them. And then also using that as great motivation to better manage your diabetes outside
Absolutely.
of the year. You know, you can't approach Ramadan and for the first time, you know, really seriously think about your diabetes. You know, that's a case where, say, from this Ramadan to next Ramadan, if a person were really focused on managing their diabetes better, exercising well, eating healthy, they could probably approach next Ramadan in a very different state with their diabetes and maybe even be able to fast.
Absolutely.
So that's really good, you know, kind of motivation for them there. I also wanted to ask from you, for somebody who is maybe fasting in Ramadan and they have diabetes, they start to feel a little bit woozy or a little bit uncomfortable in the day. What are some symptoms to really watch out for in the day that maybe, you know, it's a signal that this has kind of gone too far? It's a, you know, a case where now we have some health concerns.
Start to having shaking, sweating, feeling anxious, little nausea. All these symptoms are sign of hypoglycemia, and you know, at that point, glucose should be checked, and if it is low, patient should break their fast.
Okay. And that's, so a person, you know, they start feeling this discomfort, they start shaking, they start sweating, they have to basically immediately check their blood sugar, you know, can't wait, they can't just say, oh, there's only 2 hours until iftar.
No, that can be very serious.
Okay. So, and when you say serious, like, what does that look like?
Again, going to lack of mental status, decreased mental status, and that can lead to coma.
So you could, you know, that's something that we can't, you know, can't take lightly. Doesn't matter if iftar is just an hour away. You have to take that seriously, right, again, even if you fasted all day.
Right. And I think I should focus here a little bit on the family should recognize these symptoms, because sometimes the judgment of the patient might not be very sound during the hypoglycemia.
Right. So that's something that, you know, for the families who are, you know, listening, if you have someone in your family who has diabetes, to think about these are the symptoms, and, you know, watch out for that. If you see that, you know, maybe you help the patient test their blood sugar and, you know, then bring them something to break their fast if they need to. So that's really important. Question, in your practice, so how do you kind of bring in the family in terms of managing diabetes?
I always ask who does the cooking, and if you know, if the patient is the one who does the cooking, that will be good. If not, I ask the patient to bring their spouse, the one who does the cooking, because in the end of the day, diabetes is all about lifestyle. That, you know, it's not about the patient; it's about family more than individual. So everybody should, everybody should be on board, eating healthy and watching the amount of high carbs they eat.
So this, you know, something obviously that it just good, like, this is what we talk about so much in Amanah Fitness, getting your family involved, making healthy eating something that's a family-wide experience instead of just a few people in the family, oh, they have to eat a certain diet because they have diabetes. But really, the more you can make this a family affair, the better your diabetes will be managed. And then obviously for the people who even don't have diabetes, that's helping them, you know, making sure that they're avoiding that pre-diabetic phase as well.
Absolutely. Well, remember, you know, diabetes, there's a lot of genetics in diabetes. So if so the whole family is at risk of developing diabetes, and they all should adopt a healthy lifestyle to avoid diabetes.
Right. So what's kind of that likelihood that if you have a family member with diabetes, how much, you know, like how much more likely are you to have diabetes yourself?
It depends on the lifestyle. Again, you know, you have a patients that they all adopt unhealthy lifestyle, and, you know, you will see like almost 100% of them, they will have diabetes. Wow. Whereas those who kind of watch for that and keep healthy, keep active, you know, at least they can delay the onset of diabetes for many years.
So that's something that a lot of people, they say, oh, I have a family member with diabetes. That has to be a bit of a wake-up call that's, you know, this is a genetic, you know, a linked disease, that, you know, you have a greater likelihood then. So then you have to, again, take it that much more seriously, that for you, weight loss, healthy eating and exercise has such a big impact. And just before, we talked with Noura about those healthy eating impacts on diabetes. You mentioned exercise as well. How is exercise affecting diabetes?
Think about it. We talk about the insulin that drive the sugar to the cells. Exercise alone can help significantly in getting the cells enough fuel that get the sugar down to the cells, even with much less insulin. The exercise and weight loss help to fight the insulin resistance, make your body more efficient in using the insulin.
Wow. So before you mention, reducing, your insulin, is this a case that with a really great exercise routine, maybe a diabetes patient could reduce their insulin?
Absolutely right.
Wow. So this is something that needs to be emphasized more, because for most diabetes patients who, I've met and interacted with, it's really just that, oh, I should do this, I should do this. But it's not realizing that these recommendations have a huge impact on your experience with diabetes, your likelihood for complications with diabetes, and even the amount of medication that you're on. Like you could, be in a really great exercise program, that helps you bring down your insulin. And then if you're working on that the whole year, maybe you can bring down your insulin medication, and then maybe you could be in a position that you're fasting next year.
Absolutely, absolutely. I have I have a good example. I have a patient who was referred to me because he failed oral medications and they needed to start insulin. And I go through the diet history, and this person drink 20 cans of Coke a day.
Oh my goodness.
0.
Wow.
And,
20.
and the minute that, eliminate that. So he started decreasing that amount, and he doesn't need insulin.
Wow, that's a really great story, because a lot of people, they think that I can't change my lifestyle. I just really need these things. This is a case of a person who was on 20 cans of Coke a day. And so how did that patient, did they just stop cold turkey, or did they slowly decrease it?
Well, they start replacing it by diet and slowly decreasing the amount of Coke. Yes.
Right. So again, no matter who you are, kind of what your current lifestyle habits are, basically anytime you start making these changes has a very immediate effect on your diabetes experience, right?
Absolutely.
Right. So that's, something I really wanted to emphasize. So a lot of times diabetes is a chronic condition, right?
Yes, absolutely.
So what is a chronic condition?
Chronic condition means it is something that goes over a prolonged period. It's something that, as example, if you have flu, this is called acute situation. So because you're gonna recover after a week or so. Diabetes is chronic condition, means that it needs attention all the time. Because if you have diabetes, let's say that you lost weight, now you have your diabetes is under better control. The minute that you start gaining the weight again, the diabetes will get worse and reappear.
Right. So in some ways, that's something difficult to deal with, but that can also be a really great way for you to take your health seriously and to, really think that my diabetes is the motivator. And then once you get it under control, you know that you have to stay in that healthy zone in terms of your lifestyle changes and, kind of keep managing that, because you do have that diabetes. But if a person were to be really, really healthy, have that healthy lifestyle, do that exercise, isn't it possible that they could be even healthier than a person who doesn't have diabetes?
Absolutely. Yes, of course.
Yeah. So this is, this is really important, because when it comes to a lot of these chronic conditions, people think that, well, I'm stuck here, I just have to manage it. But it's so important to realize that if you dial in your healthy eating, your weight loss, and your nutrition, you can really get to a point where you are still living your healthiest way ever. You're still, able to do all of the things that you want to do. You're able to fast. And that has a huge impact on how you choose to live. So just because you have that diabetes diagnosis, lifestyle choice is one of the biggest impacts on that diagnosis, as we've discussed with Dr. Shrayyef today. So, this is really a case of choice. You choose the way that you want to live. You choose to bring your family on board. You have these great discussions with them. Maybe, you all watch this broadcast together, and, you figured out that your experience with diabetes is very different depending on how you choose to manage it. So that's really, really important. Really, really great tips. So Jazakallah khair on all of that. I think this is really, really helpful for people to start thinking about their diabetes, hopefully in a little bit of a different way. So that's really amazing. Jazakallah khair.
Wa iyaakum. Thank you so
So
much,
I want
Amina.
so I want to shift over now to Noura and get some really, really practical stuff on exactly how we can manage diabetes in terms of our nutrition. Assalamu alaikum, Noura.
Walaikum salam.
So
How are
those
you,
of you,
Amina?
I'm good, alhamdulillah. So Noura, she's a registered dietitian, and you deal with, well, you practice at the thyroid and hormones clinic, and so you are really working a lot of times with diabetic patients and helping them change their diets, right?
Right.
So Dr. Shrayyef mentioned that really interesting case of that patient who started off with 20 cans of Coke, and then they were able to cut it down. Have you ever seen any other cases like that where a patient started off with a really, really unhealthy diet, and then you were able to help them through making some changes?
Yes, of course. Usually patients come with like I ask them about their diets and I get a comprehensive idea of how their day go in terms of their eating and how much they eat. So most of the time, or many times in many cases, we see patients eating large portion sizes of rice and bread and potatoes. So the foods that are high in carbohydrate, and they are not balancing this food with other kinds of healthier options like vegetables, legumes, things that are higher in fiber, healthy fats, and protein.
So just very interesting, because a lot of the times when we talk about kind of nutrition as per managing diabetes, everyone just immediately thinks about sugar, just processed sugar. But you actually start off saying that portions is a huge thing, which is great, because I love talking about portion control. It's one of the easiest ways that you can still enjoy foods that you like while having them in proper amounts. So that's, so how, so you mentioned bread, rice, potatoes, these are something people have really big amounts of, but if you had those in the right portions, could a patient with diabetes still enjoy those foods?
For sure. Yeah, for sure. They still can have some carbohydrate in their diet, but the excess amount of carbohydrate, which is usually the case in the cultures that we see, is the problem. So managed amount of carbohydrates and portion sizes is a very good idea. That helps with weight loss, with sugar control as well.
So we often, kind of give people a little helpful guideline to picture, the cup of palm of their hand and kind of fill that as like a serving. So do you have any other kind of helpful tips in terms of how to portion out carbohydrates?
Using hands is a very good idea because it's easy, it's handy. There's also using the plate method, the healthy plate method. We always show it to people because it's visual, it's easy to use during the meals. So looking at your plate, a smaller plate is always preferred than a bigger plate, which are usually now available to people. So a smaller plate, dividing that plate into two halves. So the first half should be filled with vegetables, different kinds of non-starchy vegetables like leafy greens, tomatoes, cucumbers, and other preferred vegetables. They can be cooked, they can be raw, they can be roasted, any kind like that, the way that you prefer them. And the other half can be divided into two parts. So the first part can be filled with a carbohydrate source, like your rice, pasta, or bread. And the other half, which is a quarter of your plate, can be a protein source, like meat, fish, chicken, and some people prefer to have plant-based protein, like beans and pulses.
I think a lot of the times people are looking for some, this diabetic diet that's going to cure all your problems, but it really is a lot simpler than that. And that's something that we love talking about, that healthy eating, we can make it so much simpler. Portion control does not have to be difficult at all. If you follow, hand portioning or this, the healthy plate guidelines, literally it doesn't even require any thought. A quarter of your plate for carbs. If you do that, you're going to be staying in control.
Exactly. And as we talked with Dr. Shrayyef, and the diabetes diet is the healthy eating diet. So it's a family thing. Everyone should be following something like that. It's not difficult and it can be achieved.
So you mentioned kind of the carbohydrates. You said bread, rice, potatoes. So, and then we previously talked about how basically controlling your blood sugar is, kind of a really big emphasis here. So obviously there's going to be kind of a difference in terms of complex carbohydrates versus simple carbs, right? So kind of how do you recommend that for your patient?
Right. So for simple carbohydrates that we usually find in sugars, simple sugars, also in white bread, for example. So what happens with those kind of carbohydrates, they raise blood sugar for a big spike right after eating them in a short time. And then the blood sugar goes down, and it may go under the normal range of blood sugar. So they pose kind of a risk for people with diabetes specifically. For complex carbohydrates, the carbohydrates that are higher in fiber, that are available in the whole grain products, in oatmeals, in legumes, in nuts, in vegetables and fruit. So for some kind of fruits, for these carbohydrates, they raise blood sugar, but they raise it slowly, and they don't pose the risk of going low after eating them. So they make you also feel satisfied for longer and with less spike of blood sugar. In terms of other kinds of nutrients like protein and fat, they don't raise blood sugar, and they stay longer in the system, so feel satisfied for longer, and they won't cause the risk of going high blood sugar or low blood sugar.
This is so interesting because a lot of the times when we're recommending whole grains, people start getting really kind of like micromanaging, and they say, well, a lot of whole grains, they have sugar added into it. And it's like, you're missing the point here. If you're having, white bread, it's going to do this spike and then drop of your blood sugar, versus if you have, some whole grain bread, maybe the manufacturer put a bit of sugar inside the dough, but overall, you're going to have a much different experience of eating this whole grain breads, brown rice, brown pasta, sweet potatoes, all of those count.
That's right. That's right.
Yeah. And this is so interesting because they're the same foods, right? It's the same carbohydrate foods, but your body processes them completely different.
Absolutely. The fiber does amazing things inside our bodies. There are two kinds of fibers. There are soluble fibers, insoluble fibers, and they all help in different ways. They help with being regular, they help with bulking food, and they help staying satisfied for longer. And on the long run, they help reducing blood sugar and reducing cholesterol, which are two things that people with diabetes want to manage.
Okay, so tell us more about that thing about reducing cholesterol.
So what happens is that fiber is part of our food that does not get that does not provide energy in general. So what happens is that it goes through the system, and it helps in reducing that. So also it binds into the cholesterol and helps reducing that, so it won't go to the bloodstream.
Okay, so a lot of the times when people are thinking about cholesterol, they're thinking of just reducing maybe fats in their diet. But again, this is a case where having high fiber foods actually helps with that experience as well. So there's so many benefits with fiber. Obviously, you mentioned about how it adds filler. So you can kind of think of it like packing tape, right, on your food. It's going to go in, and you're not going to be digesting that packing tape. It's kind of going to move through the system and then, be excreted. And it just helps everything go through, and then that helps you actually even lower your cholesterol. That's a really, really great benefit of fiber. Yeah. So you mentioned some common foods. I mean, obviously the browns, all of the brown carbohydrates, great stuff. Sweet potatoes, great. You mentioned also legumes are great here. So give us some examples.
Chickpeas, fava beans, different kinds of white beans, and all kinds of beans. Those are, they provide a source of protein. They also are high in fiber and in plant iron. So they are considered nutritious. They contain some carbohydrates, so you won't overeat them at one meal. One serving is half a cup. You may have it with something else, so you'll balance that. Also, there's a source of fiber that is very important, and we like to talk about it all the time, which is vegetables. Vegetables are a great source of fiber. They are also very low in carbohydrates, most of vegetables, and also they are low in calories, high in vitamins, high in minerals, and antioxidants. So vegetables are great, and they are also a source of fiber. Some of them provide insoluble fibers and soluble fibers as well. Fruit, they contain some fiber, but and vitamins and minerals, but you don't want to over them with diabetes. About 2 to 3 servings of fruit a day is a good idea, but no more than that. In Ramadan, we usually see people overdoing dates, especially at iftar meals, and dates are tasty. It's sunnah to start your iftar with date. So the recommendation is 1 to 2 dates. So 1 to 3 small dates, no more than that. I like, if you like examples, I had a patient who liked to eat dates. She told me that she'll eat 10 to 15 dates when she starts her. So, and I told her, you can reduce this amount of dates because you don't want date to harm you. You want date to get the benefits from dates. So eating the right amount of it is a good idea.
Yeah. Wow, that's really interesting. And we actually hear that a lot as well, that a lot of people say, how many dates can I eat? I love dates. I'm going to just eat so many of them. But like anything else, it's the quality of food and the quantity of food. You have to put both of them together.
Yeah, so and very interesting. They come in different sizes. So there's big dates that are usually they are called medjool dates. And this one is one date is one serving.
Yes. It's true. Those really big, they're really juicy, really great, but obviously those are, they just have more content in it. So, you can't really cheat. You can't have, think that, oh, my date is bigger, so I can have, just the same amount. No, obviously it's, kind of like what your body needs. So you mentioned one of those big medjool dates, or 1 to 2 of the medium dates, or maybe 1 to 3 of the really tiny dates. And then that's, going to be good. You also mentioned about fruits. So we know that kind of fruits, there's high glycemic fruits, lower glycemic fruits. So kind of what are you recommending in there for patients with diabetes?
So it all comes to the amount of fruit at one setting. So if a person at one setting had many fruits, this is not a good idea. At one setting, it's a good idea to have one fruit, and it's another good idea is to have something with the fruit. So you are not having a fruit by itself. There are different measures that we tell people about fruit. Like, for example, one medium apple is 1 serving. For bananas, for example, they come in different sizes. Same idea. So if your banana is a small banana, this is 1 serving. But if it is a big banana, you have to have half a banana at one setting. Having 2, that means you had 2, and that may raise blood sugar. Berries, on the other hand, they are very low glycemic index, higher in fiber, lower in sugar, and they provide great benefits in terms of antioxidants and vitamins. So 1¼ cup of berries, like strawberries or blackberries or blueberries, is very they don't raise blood sugar, and this is the 1 serving of
so
them.
1 and
for
1/4.
mangoes,
So that's really interesting, because you can have a full cup and a 1/4 cup versus half a banana. So there's, the lower glycemic fruits, those berries, those are great. You still get that really nice sweetness from the fruits, but, maybe it's a better option for someone with diabetes. Yeah.
And I always tell my patients to enjoy them with a source of protein like yogurt, or have milk with that. Also have it, or can have it with a little bit of cottage cheese. So they'll enjoy the combination of the flavors, and at the same time that reduces the glycemic index, and they'll enjoy a balanced meal.
That's a really great tip there. So, sometimes I see, people like with their fruits and they're dipping them in whipped cream. And it's like, what are you doing? This is fruits. But, that's a really good idea, to have some yogurt with it, cottage cheese, any types of those proteins with it that can help not only balance out the food, but you'll enjoy it more, and it'll feel like you're eating more as well. Especially a lot of yogurts, the sugar-free yogurts, they're very low in calories as well. Obviously, that helps you control your calories throughout the day. And this is interesting because a lot of people, they're either at both extremes, so they'll be talking that, well, it's just sugar. I can just eat it, and they'll have all this processed sugar. And then on the other extreme, they'll say you can't have any fruit sugar, and they don't kind of make that distinction. So, for example, once we put up a video with bananas, and it was no sugar, and people are saying this is not no sugar because there's sugar in the fruits. So I kind of see these two extremes. So obviously, you're talking about that for patients with diabetes, yes, you can have these fruits, but it's about controlling the amounts and making that a bit more manageable.
Right.
Yeah. So some really, really good tips. So also you mentioned chickpeas, beans and stuff. That's really, really great. A lot of people, especially in the Muslim community, they're always overdosing on meat. So, kind of how do you kind of recommend that, to bring in some maybe plant-based proteins and then what are the benefits of that?
So the benefits of plant-based protein, it's economic. It's easier to get them. They're also, you can have them with different flavors and but the thing is, it's all about the preference. So if you like to have animal source, you like to have plant source, it's all at the end, it's your choice. There are benefits and pros and cons for each one of them. But again, portion sizes is your key.
Yeah. So you're really all about kind of having that balance, right? And not kind of even eliminating certain foods, but, saying that what are the foods that you like that work with your preference? How can we control them in the right amounts and then still enjoy them? Which is so good, because I'm really sick of people talking about crash diets and cutting out entire food groups. And that's not really necessary, right? You can manage it while keeping in all of these food groups.
Mm-hmm.
So sugar is obviously a big thing. So do you have any patients who are really addicted to sugar, and what do you tell them?
Yeah. So what we tell them that is to reduce it gradually. Sometimes we suggest going off sugar and starting with artificial sweetener, but for a short time, just to reduce how much sugar they are having. Because with diabetes, simple sugar is not a good idea at all. It raises blood sugar and it works on other things that are not desirable. So this is what we do, is reducing it as much as possible. So many people have double multiple times a day. So we start telling them, what about you have single one time a day? So they go with this change slowly.
So making kind of that change slowly. Obviously, you mentioned some sugar replacements. Even stevia is a great way to introduce that, as something that. So stevia is totally safe for patients with diabetes, right?
Yes.
So these are some really great tips. It's about kind of slowly introducing some changes, making kind of these a little bit more actionable in your daily life. We talked about kind of that portions. And you've really seen some great transformations, right? Of patients who kind of started off with a very unhealthy diet. They work through with you, and then it's all about having a much better experience and quality of life with these healthier lifestyle changes. A lot of people, they make weight loss the goal, but it's a means. Your weight and your health is a means to living a healthier existence and a healthier lifestyle. And I think that that's so clearly visible with patients with diabetes, right?
Yeah, and I try to let patients know that it's behavior oriented and not number oriented. So, right, you will do the behavior, you will see a result in number, but if you are not seeing the results, you are still doing the right thing for your health.
Right. And that's so important, actually, and especially a lot of, for example, women who are on our boot camp program or who are on our weight loss programs. They'll get started and they'll start feeling really good. And I get this question so much, but I haven't lost any weight yet. And it's really important to kind of use other measures of how you're doing, right? How you feel, how you look, how you function. And all of that, it is having a really big impact on what's going on inside your body, even if you don't immediately see that result on the scale, right?
Absolutely.
Mm-hmm. So thank you so much for all of these tips. These are, some really, really great tips that, emphasizing the importance of the whole grains. Everyone talks about it. Here's some exact reasons why. Now everyone who's watching knows the impact that has on your blood sugar. It's real. Just, stop making excuses, switch over to the whole grains and try and get more of those complex carbs. And then you also mentioned that, you know, kind of vegetables are a great source of carbs. So many people, you know, if you look at the vast majority of iftar meals, it's going to be like this mountain of rice or carbs, and then like another mountain of meat, and then maybe a little like side bush of vegetables. But, you know, you mentioned that vegetables are a great source of fiber, you know, complex carbohydrates. And so that's why vegetables can sub in and, you know, make that foundational part of your meal, even replace some of those carbs. So that's super, super helpful. Any kind of other final tips that you have in terms of like the types of meals that you're making in Ramadan and how to kind of make those healthier for a patient with diabetes?
Is also how you eat them, especially people when iftar time comes. They are very hungry and they start eating really, really fast, and they usually overdo it. Or sometimes many people make many kinds of food for iftar meals. Like, for example, they'll have 7 to 8 different kinds of things on the table. And if a person wants to eat from every single thing on the table, they'll most likely overeat. So I always recommend that reduce the amounts of plates and variety of food on your table, and choose the things that you really like. And again, use that plate method. It's very helpful. And do it slowly. Start with 1 date, 1 to 2 dates, then drink some water, have a break for Maghrib prayer. So that will give your body the rest. And then when you go, start with something that is more like fluid, like many people like to start with a soup that is mostly like non-cream based soup. So something like lentil soup, for example. And after that, they'll have maybe a salad, and then with their main dish, similar to the plate that we talked about. There's another common thing that we always advise against, is that don't drink sugar sweetened beverages that are very popular in Ramadan. So I know that like there's Vimto and the fruit juices. So all of these are readily available sugar. They are they are high glycemic index, and they are similar to having sugar. So it's better to avoid those in Ramadan and hydrate with water.
And that's really interesting because many people, for example, I was doing a presentation in a school a few weeks ago, and I asked the kids, what do you think is the biggest source of sugar? And they were like chocolate, candy, and the fact is that it's beverages. It's sweetened beverages, and the fact is so much sugar goes into those drinks to make them taste sweet, right? So we have like the ruafza and like all of those traditional Ramadan drinks. Like, it's just an unnecessary source of sugar. For patients with diabetes, you're basically going to say, cut them out. It's water or it's milk or it's nothing, right?
Yeah.
Okay, good to know. So, you know, definitely cutting out those sugary drinks. And then I really like what you said, that how you eat, it makes such a big difference from a psychology perspective. You know, the way that you eat dramatically impacts your eating experience. And so this is a case where, you know, you should take that break for Maghrib. You know, not only do you make sure that you pray on time then, but it really allows you to just take a pause, realize you don't have to eat the whole kitchen at your first opportunity, and just, you know, go and pray and then come back. And a lot of the times, by the time you've eaten about half of your iftar plate, I'm betting that the majority of people are already full, and they eat the rest of it just because it's still on their plate. So, you know, using the healthy plate guideline is a great way to combat that. And then you mentioned it as well earlier, using smaller plates. So many studies, you know, in psychology and food have really showed that when you use a smaller plate, you do eat less. And, you know, our brain uses that plate as a fullness cue. So it's so important to use these, you know, these principles. It doesn't have to be complicated. You know, and I'm hoping everyone who's watching, you know, and is learning from you, Noura, that we can make it simpler. Just portion control. You know, we talked about these types of foods that are really important to watch out for patients with diabetes. Fruits are an interesting thing because, yes, it's a natural fruit, but again, with everything, you can overeat on good foods. So it's about, you know, that quality, reducing the bad foods, reducing the sugary drinks, reducing the white carbohydrates, and then, you know, having those good foods like the fruits, like the veggies, like the complex carbs, but still maintaining that quantity as well, making sure that you're eating them in the right amounts. So thank you so much, Noura. This was really, really helpful, I think, and lots of really good practical tips, inshallah. that I'm really excited for people to go through and start implementing with their family. And you also you're recommending, you mentioned before that this is a family thing, right? It's not just one person. Your ideal would be that people make these changes, apply it with the whole family, and that's not only helping your family prevent their risk of diabetes, but it's helping you manage it as well.
Oh yeah, for sure.
Definitely.
Yes.
All right, Jazakallah khair. Thank you so much to you and Dr. Shrayyef for coming on here and really lending us your expertise. Jazakallah khair, Dr. Shrayyef. This was really beneficial, alhamdulillah. And it's so important that we have these discussions in the Muslim community because this is an area where we really need a lot of education, especially when it comes to your health. A lot of times the Muslim community is really trailing far back and, needs that help, that push to get out farther, right?
Well, thank you so much for bringing this program. I think it's a great educational tool.
Alhamdulillah. Jazakallah khair. We'll have to have you guys both on again in the future, inshallah, to discuss other things. And, obviously that you are specializing in thyroid and a lot of questions come up about that. So, inshallah, hopefully we can do this again in the future.
Inshallah. Jazakallah khair.
Thank you very much.
Thank you so much. Jazakallah khair for everyone who watched. Jazakallah khair. If you found this video beneficial, please be sure to share with any of your friends and family members who have a family member with diabetes or are struggling with diabetes themselves. And be sure to sign up for our newsletter where you will get more free, actionable, expert health information by clicking the link below. Assalamu alaikum.